you wouldn't mind taking your seats. I'd like to take just a moment to welcome everyone here tonight. Really appreciate and thank all of you for taking the time out of your evenings to be here, as well as those who are live streaming. Welcome. Just as a reminder as well, tonight's session will be recorded, so in the event that you'd like to go back and watch, or you have friends or family who weren't able to attend, feel free to direct them to the recording on our website at a later date. Just a few things about this evening. As you may know, about 8 days ago, we opened up a Google form on our website and began accepting questions for our esteemed panelists. We're very fortunate tonight to have a local expert panel to discuss the variety of ways that we can work together to meet the social and emotional needs of all of our students and our children. As of noon yesterday, we received over 140 questions. So again, thank you for your interest and your efforts in submitting those questions. Of course, given the 90 minutes that we have allotted, we likely won't get to all 140. And so yesterday we spent quite a bit of time taking those 140 questions and categorizing them by many of the emerging themes that we found throughout, and have those questions available tonight, hopefully representing many of the questions that we received. At the same time, we will be also having an FAQ document available for questions that we're not able to get to tonight on our website. I ask that you give us perhaps a week or so to gather that information following tonight, so we know which questions we're able to address tonight and which we aren't. And again, that will be posted on our website and accessible for you. Something else that wasn't necessarily included in the information prior was you may have already received a note card as well. So those of you who are here in the audience, if you have a question that is not addressed and you'd like to jot that down on a note card, we will, although we had intended to be finished here at 8:30 this evening, we will stay as long as 8:45 to potentially address any note card questions that you might have. We'll collect the note cards, we'll hand them to our moderator, and she'll have the opportunity to choose the ones that maybe weren't covered prior, so anyone here could have their questions addressed. One last thing I'd like to do prior to introducing our panel is just also to thank those of you who have reached out over the last 2 weeks. At the Downingtown Area School District, we've received an overwhelming amount of support, offers of assistance, offers of expertise, ideas about community and school-based programs and resources that we might be able to utilize, and we're eternally grateful for that. We've begun to compile all of those resources, and as I believe you know, we have scheduled a roundtable event that will occur on Tuesday, February 19th from 7 p.m. to 9 p.m., again here at Downingtown East High School, at which point those who would like to participate in a more active conversation about next steps can do so, and at that point we'll, I'm sure, assuredly be looking back at the list of resources that those people have provided to see how we might be able to work together moving forward. So without further ado, I will be introducing our panel. We have with us tonight Ms. Tracy Behringer, mental health first aid instructor with Chester County MHIDD. Dr. Lou Bevilacqua, president and founder of SNAR Today. Dr. Renee Cassidy, public health physician with the Chester County Suicide Prevention Leadership Team. Dr. Kyle Holsinger, clinical director of Delaware County Professional Services. Ms. Sue Lombardi, supervisor of clinical treatment programs with the Chester County Intermediate Unit. And our moderator this evening will be Ms. Jacqueline Taylor, the executive director with the COAD Group. With that, I'll turn it over to you, Ms. Taylor.
Good evening. I want to reiterate some of the messages that you just heard from Dr. Chance and thank everyone that has taken time out of their schedule to be here tonight, both physically, those of you that are here in this space with us, and everyone that's joining us via live stream as well. We are humbled by and grateful for your presence here tonight with us. And I want to kind of start tonight by acknowledging, obviously, as a community, we are grieving. And I think sometimes when we are in the midst of grief and pain and loss and sadness and fear and confusion, that oftentimes it can be really hard sometimes to identify our strengths, both individually and collectively. But I think it's really important for us to take a moment to do that in a really intentional way. Those of us that have the privilege of being here tonight, those of us that work in this field and with our young people, it's critically important for us to be able to identify what those strengths may be and to always honor and kind of acknowledge them. And so I wanted to do that for a moment. And obviously there have been very meaningful strengths that have been demonstrated throughout this community over the past week to 10 days. They certainly are way too significant and voluminous for us to address here tonight or to really identify specifically. But there is one way we can do that meaningfully and kind of clearly, particularly as it relates to those of us that are here that are joining you. And that is what Dr. Chance indicated, that over 140 questions were received, which is a remarkably impressive response, as well as the sheer number of people that are here with us tonight. So I think it's important for us to acknowledge that it's clear we are part of a community that is genuinely engaged and invested in raising our kids to be as healthy and happy and whole as they can be, and doing that in a really collective way. So I just wanted to kind of start the night by honoring that, because I think it's a really important strength, and I don't want this community to lose focus of that right now. As Dr. Chance indicated, we received an overwhelming response, which is great. It was also a little overwhelming, if I'm being very honest, as we tried to figure out how do we best use the 90 minutes we have to ensure that you feel that your time spent here was well spent, that it was effective, and that you leave in a position feeling that it was worth your time. And so you heard about the process that we engaged in and how we're going to kind of navigate tonight together. I want you to know that it's a privilege for those of us on this panel and part of this process to be here. We have very intentionally and very thoughtfully considered what we want this evening to be. And our goal is that we build understanding around the critical issues of adolescent development, mental health concerns and challenges and illness, and suicide, and that we share information and resources and supports related to those topics. It's our goal that you leave here tonight feeling more informed, better aware, better equipped, and hopefully more empowered in this really important work. And so with that, we're going to kind of get started. So we're going to start from a place here. We received a lot of questions about approaches to parenting and different parenting strategies, particularly with respect to creating a balance of expectation and pressure, and how do we navigate that? So for example, several parents had questions regarding the frequency with which either they or their child or children should be checking their grades, as well as in this culture, how parents help teach their kids that being average is okay. So our first question for the panel is, what are some things that parents can do to foster this balance at home with their children?
I would say one of the first things that you can do as parents, which is very difficult, but it's modeling that balance that you want your kids to follow. They often are checking their grades, and you're often checking their grades, and that kind of supports and reinforces this pressure that they're feeling that they have to do so well. And one of the ways that we may do that is we're checking our phones, we're checking our emails constantly. How often are we doing that? Is that what we want them to be doing? So one of the things that I would encourage us to all try to do is do that less. Show them that we don't have to constantly be checking our email to get ahead, so that they can start to realize that there's more to life than just grades. It's about that balance. So the more that we're able to model that, the better it is for them.
And I'd also add, communication is such an important concept, and for each of the questions I think that were presented, I keep thinking about the importance of communication, and silence is kind of the enemy of just letting things go without commenting, talking, or discussing. So this is probably over a long period of time of how each of you communicate together, how parents communicate with your child and adolescents, and that's something that takes respect, time, and repetition. The more you practice talking and asking questions and trying to connect, the more you find out. But silence is something that I would suggest also is something to be avoided. Talk, communicate, learn, exchange.
Along the lines of communication, I think it's important to be very explicit with your teens. You
need to not care about the grades. If you want your kids to be less focused on the grades, tell them you don't care about the grades. You care about their effort, you care that they're doing the best that they can, but that the grades aren't important. And follow that up, being very explicit that they're worth to you, they are valuable to you. Their worth is not dependent on their grades. No one would argue that parents will only love their children if they get A's, and yet we're often inadvertently conveying that attitude by sort of the way that we focus on things. And it's okay to have high expectations, but be very explicit and communicate to your kids that that's not what matters in life. Because if you take a step back, it really isn't. Nobody cares what grades they get. Nobody should care no one knows what colleges people went to or whether they went to colleges. People know what kind of person you are later in life, and there's all kinds of ways to get to where you want to be. But communicating that to your children is important, because I think it's easy for teens to feel like that's the single most important thing in life when you're in a high-performing school district in particular.
I think it also gives us an opportunity to teach our children how to self-monitor. They need to take some responsibility in self-monitoring their grades, and we as parents have to trust the process. Progress reports come out midway. We have to set them up to learn how to be responsible in their academic achievement.
And I will say there's going to be overlap with respect to some of the feedback that you hear from the panel and some of the questions that we're going to visit later on in the evening, because I presume that your wheels may start to spin as you hear some of this information. And so we hope to build on that in pieces as the opportunity allows as well. But our next question, and I'd like to start with Dr. Cassidy if we can, is there was a lot of questions specifically related to the social emotional wellness of our children. And within that, what can parents and schools do to help support that development? There was a lot of feedback and inquiry regarding sleep and perhaps the absence of sleep, and how fatigue plays a role in our lives in a variety of ways. So what we'd like the panel to speak to specifically is not just the importance of sleep when we're talking about overall health and wellness, but looking at that topic really broadly and speak to nutrition, what the balance looks like for our young people in managing their school responsibilities, but equally in having opportunity to healthy, pro-social, constructive recreation, and what other components are important for them to have healthy development and how we support that.
Thank you. I think there is a lot of conflicting advice out there about how to be healthy in life. You could read reams and reams of information about different kinds of diets and things like that. But I try to boil it down to being a little bit simpler. So I think the first and most important thing is activity. Exercise is the best medicine. Exercise has been linked to decreased anxiety and depression, increased memory, obviously the connection with the heart and cardiovascular fitness and all that kind of stuff is well known, but as far as a stress management technique, it's important. And it doesn't matter what you do as long as you're getting out there. The second thing is a healthy diet. We have linked very heavily diet with weight, but there is a huge body of evidence that diet affects everything else, inflammation and your mood and all kinds of different things. And because it's so complex, I boil it down to just eat a lot of vegetables. That's it. Just eat a lot of vegetables. That's my only dietary advice for you. Avoiding harmful things, I think, is the next most important thing. And I would lump that in with tobacco, any kind of drug use, alcohol, marijuana, any kind of use. In particular, in adolescence, while your brains are still developing, there is a lot of indication that can cause structural and functional changes, which do appear to be permanent. And so any kind of harmful substances is something to be avoided at all costs. Managing stress, and there are numerous ways to manage your stress. But two I really like because they're simple to do are meditation and a gratitude journal. People who express gratitude and focus on gratitude are happier in life. And finally, with respect to sleep, sleep is really essential. I think it's well known in our society, the links between, the harms of tobacco use and cardiovascular disease or certain kinds of things. I think it's less well recognized how essential sleep is and how much it affects your health, your immune system, your cardiovascular system, pulmonary, your weight, and certainly your mood. And I think one of the things that we see being very disruptive, particularly for adolescents, is the social media. I make a hard no phones in the bedroom rule. I advise that for people because the texting all night, the little ding that happens, is extraordinarily disruptive to sleep. And if your kids are telling you that they have to set an alarm, buy them an alarm clock. You do not need your phone in your bedroom at night. It really is very disruptive. And sleep is a little bit more difficult in the adolescent years because of their sleep-wake cycle, their circadian rhythm being a little bit off compared to early childhood and later in adulthood. But there are still ways of managing to get enough sleep, and there are still ways of ensuring that kids recognize the importance of sleep. And I think all of these things go for parents as well. We need to take care of ourselves. Suicide and mental illness are not just a problem of the young, they're very much our entire society, and we need to be taking care of ourselves and each other and modeling good behavior for our children as well.
And I think the self-care concept of making sure we take care of ourselves is so important. Even compare it to a recipe that you make. What's the recipe of you? What are the ingredients that you want in your life? How much playtime do you have? Challenges, whether it's exercise, diet, sleep. Check your recipe, because adjusting that can be a very healthy thing. And for adults and parents, working on your self-care, because your patience and level of handling the stressors is going to be modeled to your kids. Taking care of yourselves and checking your recipe is going to help come out with the best shape of you.
Thank you. So one of the most important determinants for our health is related to social connectedness, of course. And isolation is in fact a risk factor when we start talking about mental illness and suicide. So we have a couple of questions that are going to kind of lead us down a path to start to talk a little bit about social media and perhaps real connection, but we're going to start with the idea of fostering attachment and fostering relationships. And so I asked the panel, how do we as a community and how do we as an educational system foster meaningful attachment and relationships with our young people? What are ways that we can do that? And what are ways that families can do that?
I think, again, through modeling. I know a lot of times as parents, we tend to focus on our kids and them having friends, but it's also very important for us as adults to have friends and demonstrating that connection and the importance and the value that we place on that friendship. Some smaller ways might just be in the neighborhood, that when you are outside, that you just wave to the neighbor next to you, that you say hello to them, to show that it's okay to talk to different people. And how do you do that? And if your kids can start to see that, then that's again the modeling that I'm referring to, that shows them that this is okay.
Sue, can you speak to ways that we foster attachment in our schools and educational system?
I think we can start by what Lou had mentioned. I think parents have to reach out to the schools and show their students, here's who you reach out to if you have an issue. This is a safe person. When I have a concern, I'm going to call such and such. That's where we start to model. But internally in the schools, kids need to have the comfort level to approach a teacher, to approach a guidance counselor, to say hello to the teacher who's in the hallway. The teachers hopefully are saying hello back. It's a back and forth.
And to add to that, in the school, earlier, Kyle and I were talking about how it takes a village, and we have a village right here, and the students need to take some responsibility for that as well in regards to when they're in the school, to be able to say hello to other kids. We know the kids that are isolated, that are alienated, that are not getting connected with anybody else. We can make a difference as a community, as a school community, as a culture, by having our kids start to do the same thing that they want and that they need, just by saying hello to somebody. That makes a huge difference to somebody who feels very alone, who feels very isolated and like nobody cares. Just the idea that somebody says hello to them and acknowledges them, notices them, can make a world of difference in their life.
And we talk about risk factors for suicidal thoughts and actions. We also talk about protective factors. What are the things that helps insulate us? And one of the most significant things is connection. Do I feel I have a connection? Am I connected to a teacher? Am I connected to a parishioner? Am I connected to a parent, a neighbor, a friend? Connection is the key. And sometimes it takes one question to ask, hey, how you doing? That check-in can be that connection. And I think whether it's between the school, whether it's family, whether it's community, as Lou and I talked, it takes a village. Be connected, reach out, just say hi. But that one word could be the connection that someone's looking for.
We're also blessed in our community and in the school district to have numerous opportunities to connect with other people. I don't even know how many clubs there are, groups, sports, arts. If your child can't find a particular group or club that they're interested in within the school, going out to the broader community, and even online groups. We think of social media and online as not real life, but there are ways to forge connections with other people. Particularly if you're in a somewhat smaller group. Let's say you're maybe an LGBTQ youth and you're just not feeling that there's a large group with whom you can connect within your class, for example. Reaching out to other people who've gone through the same thing can be valuable as long as you're not, sort of spending your entire time online and not ever getting out in the sunshine and all that kind of extreme.
I would agree. I mean, I don't have too much more to add other than we are lucky that, Downingtown School District and all of the Chester County school districts have a lot to offer to the students, a lot of options. And I think for parents to just encourage that interest and help them connect, whether it be a club or sports or whatever. I think that, just talking to your child and finding out what kinds of things do interest them is really key.
And I love that Tracy used the word encourage, right? So much of this, we have to remember all of our kids are uniquely different, and we have to kind of honor and cultivate within them where they find joy and satisfaction, or where that interest might lie, and it's not going to be consistent. And so for some, if I'm an athlete, perhaps it's really easy for me to find my space, and maybe if I am not an athlete, I have a little bit more of a challenging time. But I think the district as an entity and the community as a whole has such vast opportunities for engagement regardless of what that area of interest may be. We might sometimes have to look for the information, which can seem frustrating as a parent, but we do have to play that role and kind of encourage our young people to use their voice and help them find a space where they feel comfortable, where they feel safe, and where they feel valued. I'd like to ask Sue if you're receptive to this before we move on, just because there were a lot of questions related specific to kind of education and the educational system, and I'm wondering just really broadly if you don't mind speaking to a little bit as it relates to school climate and just general educational initiatives that exist that work to engage students on a much more consistent, meaningful, intentional basis that parents and families might not be aware of that's happening every day.
Sure. Thank you, Jack. That piece of paper, but, so I think what, in the education world, when we approach mental health, it is ever changing. When we look at what mental health was 20 years ago, and when we look at what mental health in the school is today, it doesn't even look like the same beast, right? Our educators and our administrators and our schools are always looking to see what are we missing, how are we meeting this need, and it's constant. So, you know, we have many school-employed professionals who are trained in mental health, from our school nurses, our school counselors, our school psychologists, our prevention specialists, our mental health therapists, and they all play a different role within the school system. But their focus is on helping to create a safe and social emotional learning in the school world. They're not responsible for the whole kit and caboodle, right? So what we have to do in terms of the educational world is look to partner collaboratively with the outside community to ensure that the whole person gets addressed. Our nurses, you know, they spend a lot of time with kids. They get to see the belly aches and the anxiety and self-injurious behaviors and the more physical components of it, right? Our guidance counselors have the opportunity to interact with kids across the whole community of school and provide them with social emotional learnings to make them better people. Our school psychologists are able to intervene and do testing and assessment, make recommendations to help better them along the way. And most recently, with probably in the last 5 or 10 years, our mental health therapists have now integrated into the school system to provide cognitive behavioral interventions and teach kids how to be more successful in their school learning. All of those people are responsible to help connect kids outside, communicate with their parents, collaborate with their parents, and they do so in so many different levels.
Thank you.
If I may,
ahead,
just this might be a good time to have a plug for a club, an organization that I know is in each of the high schools in Downingtown. It's called Edom, and that's kind of a made-up name by the kids who developed this club or program. And Edom is a program that really started, it really was developed by students who lost one of their classmates to suicide. And so in response to that loss, the students, and it actually started in Lancaster, developed the name of the program, and it's all about supporting each other. Edom, the students defined as "I've got your back." So it's a great supportive way for kids to engage with their classmates and, you know, feel that support themselves. You know, like I said, each of the high schools have that. So it's just a nice thing that parents may want to encourage their children to get involved in.
I think we should also say that we're also doing a better job at training educators, training teachers, cafeteria workers, school bus drivers, on what to look for and how to support kids. Downingtown has trained their kids and staff in QPR, question, persuade, respond, which has been it's an R. And those are all things that we can arm everyone with in terms of helping kids. Safe to say something, you may have heard of it, but you may not have yet. And if you haven't, it's coming soon to Pennsylvania. It went live on Monday. It's another opportunity for students to be able to support each other when they have concerns about a friend or a peer, being able to reach out anonymously and provide them with an intervention, someone to be able to make a connection and reach out to. So all kinds of wonderful things are happening in the state of Pennsylvania and in Chester County.
And as Sue said, the landscape is ever changing, and that's certainly true. And you spoke really beautifully, right, to some of the student support services and some of those specialized positions that may exist in this district as well as in other districts. But I'd also just like to note that when we talk about school climate and we talk about universally kind of what those expectations might be, this district very intentionally at all levels, regardless of what your role may be or what your training may be or what your position is within this district, they're charged with the responsibility to conduct themselves in a certain way and to engage the students in a certain way and vice versa. And so there's a very clear pathway, and I'm certain that might be part of the FAQ document because it was pieces of what was asked of us. But there is a prescription with respect to how we engage our young people here and how we're working intentionally to do that at all levels for all students all the time. And so I just think it's important to note that too. So we start talking about fostering connection, and we know social media is a reality, and there's a lot of benefits to its existence, and maybe perhaps there's some harm. So we had a lot of questions regarding, and here's where we'll start with this topic, is when we talk about social media, does the panel have any recommendations for parents regarding restricting access to social media or certain apps, monitoring the use of such, and/or controlling their child's access to social media and/or just technology in some capacity? So do we have any recommendations on some best practice guidelines for how parents developmentally appropriately set those expectations in their home?
There are actually a number of organizations online that have sort of put out kinds of things, and we'll make sure to get some of those links to you to get more detail. But in the general sense, with regard to restricting access, if you have younger children, restrict access sort of as long as you can until that they've demonstrated responsibility and sort of the ability to handle certain things. I think that you need to make clear that the phone is yours, it's not theirs, and therefore you have the right as the person who's paying for the phone and the person who is in charge of their health and well-being to look into anything that may be suspicious. Now, the reality is you're not going to read every text. Those texts aren't even there anymore if they're snapping or whatever. They vanish off the phone. But if your children are aware that that's going to be something that you have the ability to monitor and are interested, and it's sort of a trust but verify. I would say I have a hard rule that I advise people of the not using it at night. So removing the phone from the bedrooms at night. You can keep it somewhere locked up, or you can keep it in your own bedroom as long as it's off or whatever the case may be. But that's probably the most dogmatic I am about, because it's really not healthy. I've also seen a number of other approaches where I think this is healthy, but if kids are getting together for a party or something like that, collect all their phones. If they're all there having fun with each other, there's nothing really good that comes out of them texting other people. Let them interact with each other, and then that sort of squashes a little of the fear of missing out, the exclusion of other people who aren't there having fun with them. Just enjoy each other's presence. It's hard to change the rules in the middle of the game. So I realize that if you guys have teens and you haven't been enforcing any rules, that makes it even more difficult. But having a candid talk about how they relate to social media and technology in general, and seeing if you feel like it's not healthy, talking to them about why you need to walk back some of what they were previously allowed to do. And once again, modeling it yourself. Make your dinner time. If you guys have the opportunity to eat dinner together, and we don't all because we're all coming and going to sports and events and this and that, but if you have the opportunity to eat dinner together, make that a technology-free time. Nobody can have their phones, and doing other kinds of things that can model, I think, is a good place to start.
And passwords is always discussed. People always ask about, what about my child's passwords? For parents out here, raise your hand if you know your child's phone's passwords. Raise your hand if you don't know your child's passwords. Because there is that level of privacy. How much privacy and responsibility do I give my child? It's a very individual family decision to have that conversation. But I think it's a clear, just to reinforce that expectations, have that talk. Discuss it before, not after. Discuss it before there's a conflict, not show me your phone, I've had it. And having that conversation of this is why I want to look at your phone, because there could be many concepts, many things here that mean something else. And I have that concern, and I'm your parent, and I'm always going to be your parent. But have that discussion and be clear in your expectations and revisit that discussion. It's not just once at the beginning of the school year and never again, but checking in and saying, I am going to check periodically. I want to make sure that I'm taking care of you, and I love you very much. I want to care about you, and this is one of the things I do to demonstrate that. Does that make sense? It's a hard conversation, and it's individual to each family.
I would just add too that as a parent who had, my children were grown before all the social media and constant, online access was really a thing. But I know that, it's sometimes some of the apps and the use on their devices is even hard for us to know exactly what they're doing. And I know that there are organizations and apps and presentations. There's an organization called Shape the Sky that Chester County Department of Human Services has brought. Then they do presentations and trainings for parents, because it's one thing to know their password and to have a conversation about it, but sometimes some of the apps or things that they're using on their phone are so buried and hard for us to even see or find on their phone. So I wouldn't just have a conversation and think that was it handled it, because sometimes there's more going on than a parent could ever even know just by, looking. So I would encourage finding out more, maybe checking out some other resources and, again, other apps that parents can use. I know that I have a friend who has teens, and she has an app on her phone where she can cut off their access. So thankfully I never had to do that, but it's available.
If I could actually just add one thing, because she said it's not just one conversation.
Yep.
That goes for everything that's difficult to talk about. You as parents can't have a birds and bees talk and think that you're done with talking about sex. It doesn't work that way. And you don't have to have all the answers, and you don't have to be perfectly comfortable having a conversation about suicide or mental wellness or drug use or anything like that. But having small dialogues on an ongoing basis, taking every opportunity to bring up something that's important, and just making sure that your kids know that you are a person that they can go to even if the conversation is uncomfortable. If you're so uncomfortable, if your child brings you a question that is going to be awkward, and you cannot even sort of respond or acknowledge it in the moment, you can say, wow, that really caught me off guard. I'm not ready to answer that, but that is something that's really important for us to talk about. So give me a minute and let's pick the right time for us to have a talk about it. And follow that up with multiple conversations. So I think that it's not just social media, but all these difficult things that we have to talk about with our kids are ongoing back and forth dialogue.
I would just, go ahead. Go ahead.
And a lot of what we're talking about is communication over time, and that really speaks to the relationship that you have with your kids. And the stronger that relationship is, the easier it is to have these kind of conversations, to set down some of these limits or guidelines that you want based out of concern. And a lot of this also focuses on trust, not just that trust that you have with your kids, but that your kids have with you. It's a two-way street, and we need to be able to have that kind of relationship where people are able to trust that what you say you're going to follow through with, and also what you say is what you mean. And the more that we're able to model that consistently over time, the better that relationship becomes, the more trust that it has, and the more respect that we have with our kids, the easier it is to set a lot of these parameters in place.
I think I was also just going to say that not all social media is bad, right? When I look at our adolescents who spend this much time looking at themselves and taking pictures, and I think, boy, back in our adolescence, we would have never done that. So the fact that they have the comfort level to send their friend a picture of themselves and share this with that person and share this with that person, I think we just need to encourage them that when they see something that's uncomfortable, that they have the comfort level to come to you and say that this bothers me, or I'm concerned, or I don't know what to do. Let's help them have a voice to take care of other people. Just saying.
I think you've repeatedly heard the word, right? Modeled. What do we model for our young people? And in reality, regardless of kind of what we're discussing, we are in fact modeling behavior for them consistently, whether we're doing so intentionally or consciously or not. And sometimes the absence of communication is in fact communication. And so I think Dr. Cassidy said something critically important that I just want to reiterate before we move forward, because we hear this all the time, particularly when we're working with parents. We may hesitate to have a conversation because we're not really entirely comfortable ourselves, or perhaps we don't know all of the answers. And so I challenge you, right, to accept kind of the responsibility to be vulnerable in front of your young person, to be present and to be authentic, and to know that it's okay not to have all of the answers. That's a really critical life skill that we can help our kids develop when we demonstrate in front of them the ability to hear a question and to receive it and say, wow, that was really significant, and I'm not really sure what to do either, or I don't know how to answer that, or whatever that might look like or sound like. But sometimes we're so paralyzed because we think as adults we need to have all of the answers, particularly for our kids, that it impedes our ability to kind of ask the question or engage them, and our kids are reading our nonverbal communication. So I just encourage you to think about whether or not you are comfortable being that vulnerable and accepting that it's okay not to have all of the answers. You don't need to. You simply need to be present, and you can teach them a really great life skill in that process. And then it cultivates that relationship of comfort and continued communication, which is so critical. So we're gonna transition a little bit now, panel. And I'd like to start talking about behavioral health concerns. So we know that adolescent development in and of itself is a time of really rapid development, and there's a lot of change that's happening, and it can be really difficult for us to know what might be typical versus what might be worrisome. So we'd like to kind of start with, what are some signs and symptoms that parents can look for that might be indicative that their young person is experiencing a mental health challenge, or maybe developing a mental health concern, or that should raise their level of concern?
Well, anytime you're looking at a mental health condition, there's certain things that need to be in place. And it's not just the symptoms, but there needs to be a duration of those symptoms, and it has to also be impacting their life in a negative way. And when those things occur, that's when you can technically be labeled with a disorder, if you will, or a condition. So if you're looking at your kids and they're acting up, if they're really sad and moping around, they might just be down. They might just be sad. It might not be major depression. But when you see that happening for, several weeks, and you're seeing that affect how they're eating or sleeping, and you're seeing that this is something that's affecting not only their relationships, but their school grades, or maybe working, or their sports, that's when it becomes a concern, and that's when you want to try to do something about that, whether that's have them go see the school counselor, or maybe talk with a therapist, or get into some kind of treatment. I think a lot of times we get very nervous, though, when we have our kids feeling really down and really sad or very anxious. And we're quick to want to fix it. You know, as a parent myself, the worst thing is to have our kids struggle. We want to, jump in there and make sure that they're okay and take care of things. But a lot of times, if you give it like a few hours, maybe even the next day, you kind of see that our kids are pretty resilient in many ways, and they kind of bounce back, and what just happened an hour ago is no longer affecting them. And so we need to just kind of watch a little bit and kind of stay connected with our kids to find out what really is going on, as opposed to jumping in and thinking there's something really wrong right away.
And knowing the difference between normal developmental changes versus changes of concern, right? That is a hard concept. Is my daughter just being sullen and angry like a normal teenager, or is this depression? My son stays in his room and just does work or just stays to himself. Is that normal? It depends on your child, but change is an indicator. Now, part of this is physiological. When someone goes through hormonal changes and puberty, there are changes. Your child may have gotten up at 8 a.m. before, and now with this, sleeps till noon. It can be normal. Isolation, changes in mood. But that comes back to that knowing your child. Is this a change that is normal development? That's part of the conversation you have. And as Lou said, it depends on duration. Is it something that lasts for a day or two or a week, or is it something that lingers to months? That would raise more concern. But communication and talking and checking in, again, not silence, you want communication and asking. So there are changes if someone is isolating, staying in the room, not coming home. Have that conversation. Hey, I noticed this is something that's really important to me. I'm concerned. Or help me understand. Open-ended questions. Sometimes we ask our kids closed-ended questions. Has anyone ever asked their kid, how was school today?
Fine.
Fine. What'd you learn? Nothing. Well, this is, tell me about your day. Or tell me what was best, worst. Best from the day, worst from the day. I heard from a family, rose thorn. I like that one too. What was a rose? What was a thorn? If you start that conversation, there's more information than just yes and no. And that helps understand those changes. Is this normal in development and just learning and development? Because sometimes a child just needs to be on their own because that's growth and maturity, and that can be hard. But have that conversation.
And try to have your intent to learn, to understand. Oftentimes, adolescents, every time I talk to them, one of the things that they are frequently saying to me is that I just feel judged. I always feel like I'm wrong. I can't talk about anything because it's going to be wrong or it's not the way my parents want it to be. We do that unintentionally often, and it's out of care and concern that we want the best for our kids. But if we can try to have those kind of conversations so that we can understand what our kids are thinking, why they're thinking that way, as opposed to telling them that's not the right way to think or that's not the right thing to do. The more that we understand where they're coming from, the more they'll talk to us. The hardest thing, I think, for us as parents is to just sit and listen. We need to start listening more to our kids as opposed to jumping in and trying to fix and do for them. They need to learn how to take care of themselves, and we can be their support and guidance with them, but if we don't understand what's going on, then we really can't help them fix anything. So the more that we're able to listen to them and understand, the more they're going to talk to us, and the more together we can work on whatever they need.
I also think it's a common reaction for teens not to want to talk with you. So if you're asking them, I've noticed that you seem a little sad lately. Would you like to tell me what's going on? And they want to slam the door in your face and say no. That's okay. It can be a developmentally appropriate thing for them to want to pull away. We're expecting that during adolescence as they're shifting from being a child to being an independent adult. But emphasizing to them that you're there to listen, or when it's a good time, let me know if you want to talk about this. And saying that over and over again. So as we talked about here, everybody has anxieties and depressed mood at times, which doesn't necessarily mean you have a clinical diagnosis of an anxiety disorder or depression. And even though we may not consider it a problem until it becomes a very long duration problem or a very serious problem, having those conversations frequently, checking in with them and saying, it does seem like you've been a little bit sad, and doing that you're not necessarily saying that you have a clinical diagnosis of depression and let's go talk to a therapist from the moment they express any sadness, but just being there and saying, let me know if you want to talk about this, I'm here for you, and modeling, again, there are ups and downs in life, everybody has that. Letting them handle some of these things, I think, is one of the most important things. I think, to emphasize again, we want to solve their problems for them. We want to, and we've become a nation of helicopter parents and bulldozer parents who just clear out any problems or challenges. And we need problems and challenges, particularly during childhood and adolescence. We need to have them. We need to recognize that when something terrible happens in life, we can overcome that. And I'm not talking about throwing them out there in the middle of the ocean with no lifeboats, but the normal challenges that we have in our day-to-day lives are really opportunities for them to grow, to learn how to handle adversity and to grow as a result of it. So, may I give another plug then? Yes. Okay. So this is maybe a good time to mention that Chester County also has a fantastic program for, it's a public education course called Mental Health First Aid. Has anyone heard of it? Yeah. So there are a couple of different variations of this course. It's an 8-hour course, so it's kind of a time commitment, but it's generally at no cost. It's almost always free in Chester County. So, and it's offered throughout the county at different times, sometimes, in 2 4-hour sessions or something like that. So to make it easy for the community to attend and take advantage of it, because just like, Red Cross First Aid teaches people how to respond and help someone who may be having a medical concern or crisis, Mental Health First Aid teaches us how to notice that something may be troubling someone, that someone may be struggling, to learn the signs and the red flags to look for, and then how to have those conversations in a meaningful, non-judgmental way. A lot of times, myself as a parent, some of the things we may say to our kids with the best intentions just land the wrong way. So again, just cultivating those listening skills and having some helpful ways to encourage someone to speak, your child to speak to you. Mental Health First Aid is a really great program for that, and I would encourage every parent to take it, really. I mean, generally the parents we see in the classes are perhaps parents who are maybe concerned a little bit that their child may be struggling, but at some point or another, we're all going to have struggles in our lives, and it's helpful to know, how to respond. So that's my plug. There are flyers out front, too.
There are flyers out there, and we do have a training on February 16th, so please feel free to register for such. We would welcome the opportunity to broaden our community of mental health first aiders, and again, the goal is really to build understanding, to provide skills, to provide a framework to respond in a very intentional, meaningful, effective way. And we all can benefit from that if we are raising young people or interacting with them in any capacity. So we talked about it because it's individualized, right? So we need to know our kids, and we need to look for changes in their mood, in their behavior, perhaps in their peer group, in their relationships, in their patterns, and then we look at the frequency of them and the duration and how disruptive they may be to try to ascertain when should I be worried, perhaps what might be typical. But when we talk about suicide, are there any specific warning signs or symptoms that parents should look for specific to that topic?
And I would divide that up also because the risk factors and warning signs are very separate and very different. And sometimes it helps to think about medical conditions to compare that. So risk factors are things that you look historically. A risk factor for such as a heart attack would be someone who has hypertension, maybe overweight, a sedentary lifestyle. Those are risk factors. And then warning signs would be pain, difficulty breathing, immediacy. So similarly to a suicide risk factors, you'd look historically. Does someone have a history of major depressive disorder? Someone have a history of substance use disorder? Is there a family history of suicide? There are factors in the background that doesn't make someone suicidal, but you're looking. Those are factors that open your eyes. And the warning signs is the immediacy. The warning sign is that heart attack, giving away possessions, a mood change suddenly from depression to uplifted happiness, significant changes, or expressing it. It could be very overt. I'm thinking about killing myself. Warning signs, that's the immediacy. So those are the factors, and I know, I think each of us have literature out in the front, in the back too, or in the front of the auditorium on the other side, to look at these factors more. You can look at those tonight, go over them with your children as well, because the discussion is important. Don't be afraid to ask. If hearing those warning signs, don't be afraid to ask, are you having thoughts of suicide? That's one thing a parent can be afraid of asking. Maybe I make them think of it. No. Don't be silent. In the Veterans Administration, they have a program, and it's called Ask the Question. And that question is, are you having thoughts of suicide? So, asking as well.
Yeah, just to go along with what Kyle was saying, the idea of asking about it can be very scary. We don't necessarily want to hear the answer sometimes. But keep in mind that if you say to your child, are you thinking of hurting yourself? That's not the same thing as asking if they're thinking of suicide. They might think of suicide as a way of relief, something that doesn't cause pain anymore. They're trying to get out of the pain. So we need to be direct when we're talking about what suicide is. It's about killing yourself. And that's hard to hear. You know, as I was just saying it right now out loud, it was like, God, that's awful. And it feels that way, and it's scary. And we need to be in a place that we can talk about that. And so the idea that you're all here tonight kind of tells us you're getting to that place. It's okay. And the more that we're able to have this conversation, the more we're going to be able to have this conversation with our kids.
A couple reactions that I would like people to be aware of that are maybe are counterproductive. One is ignoring when someone says they'd be better off dead or I want to kill myself because you think it's a joke. And I think that the students themselves often, if they hear a friend saying that, the friend could put it in a very jokey manner to cover up the pain that's there. And I think everyone should know that whenever someone is saying something along those lines, it really needs to be taken seriously, that it's a cry for help. And then the other thing that I sometimes hear is if the parent hears from a child, I'd be better off dead, or I wish I were dead, or I'm thinking of killing myself, and your reaction is, well, don't say that, that's terrible. I think that is sometimes, it is terrible, we know that, but I think that can inadvertently close down the conversation. Okay, well, I'll no longer tell you when I'm having these thoughts of killing myself because I know it's something that you don't want to hear. As horrible as it is to hear those words coming from your child or from anyone else, really, we really have to be open to hearing that and to taking it seriously. And you may feel wholly inequipped to handle that. That's normal. We know that. That's probably, why many people are here tonight. You can educate yourselves on, a slightly higher comfort level. This is never a comfortable conversation. But QPR is one course, and that one's only 2 hours long. If you can't kind of dedicate an 8-hour day to a mental health first aid, QPR is specifically about suicide prevention and getting the comfort level. And if you can't, if you have no way of handling those, there's a suicide prevention hotline, there's the Valley Creek Crisis Center, there's the crisis text line. There are resources, and we're going to get you all of that information. A lot of it's out there already, but it's also going, on the website with the FAQs, so that, you don't have to have the answers. You don't.
So, and I should add that we know that a lot of times when a young person especially is feeling this, depressed and sad and possibly suicidal, a lot of times the parents don't have a clue because maybe they haven't seen signs that they recognize. They are not necessarily the ones that the child is going to go to. And we know that students talk to their friends when they're feeling that bad, when they're feeling depressed and suicidal. And, even as young as middle schoolers have reported, we'll ask in trainings or classes, who did they tell? And they all acknowledge them, the friends. The friends know, the parents may not. So, I think that's an important thing to remember. And so that sometimes it takes a little more from a parent to really, notice, investigate, ask. Any marked change in, behavior, mood, sleep, eating. We know that isolation, we've talked about that. And I would encourage, again, I sound like I'm pushing all these programs on everyone, but I work for the county office of mental health, and I know that a lot is put into these programs for our community to make sure that everyone's educated and equipped. It's a complicated world we live in, and it's up to us as parents to take that on for our kids, and our kids are doing it too. We've talked about QPR. In the last year, in 2018, Chester County's Suicide Prevention Task Force, I'm a member, Renee's a member as well, we have trained, and Jacqueline as well, we have trained more than 3,200 people, individuals in Chester County in this 2-hour life-saving course. And it's saving lives, undoubtedly. A lot of the people we've trained were students or staff in schools. And it's really just, knowledge is power. And it's important for all of us to take advantage of these educational opportunities. The students receive the program very well. We've trained 9th graders is kind of generally where we're starting there, but it's offered for anyone. It was designed along the same lines of CPR, simple life-saving skills, and the Heimlich maneuver. Anyone can learn these skills because it is a hard conversation to have without training, without some discussion before you have to talk to someone, especially someone you love and care about. It's very hard to get the words out. But it's crucial that we all know about this and feel comfortable with the conversation. We know that suicide has been on the rise in the United States for the past decade. It has been steadily increasing. And it's not just the United States, it's a global problem. But Chester County, unfortunately, I mean, we are a very healthy, safe county, but we have seen our statistics rise too. And, you know, I mean, I can talk, get me started on this topic, but we know that, yes, we have lost some young people recently, and every single one of them is a tragedy. But we also know that suicide trends in the United States and in Chester County, really a lot of what we're seeing is middle-aged men, specifically. So that's important to know too. You know, it's just, this information is not something that we normally access in our daily lives, and especially if you're going along and you don't realize there's a big problem. But it is important for every citizen to know about this, just like we know about health, our physical health.
We have a tendency not to talk about that which we don't understand or we don't know and we're not comfortable. And so one of the really important consistent initiatives that we've tried to do in Chester County is have a very robust public education and outreach spectrum of services and opportunities for training and engagement to be able to provide this information related to mental illness, adolescent development, suicide prevention, because one of the greatest barriers is in fact stigma and shame and guilt and fear and that lack of knowledge and that lack of understanding. That's a barrier to many of us talking about the difficulties or challenges that might be happening with us individually or within our families, or being brave enough to start a conversation or ask for help. And so the more we do to normalize that conversation and to destigmatize these topics, the better prepared we are, right? The better equipped we are to be able to respond and to be able to intervene early and have much better outcomes, because we do have a really strong system of support. Kyle, and thank you for highlighting the difference between a risk factor and then what an indicator might be. And there is information out there related to that. But we did have a question specifically with respect to what should parents do if their child is not displaying to them what they perceive to be very overt indicators? Is there any recommendations on how we navigate that, as well as perhaps when you start that conversation and we utilize our open-ended question when our child doesn't engage us back and is resistant to communication? What strategies can we use as parents?
Well, we're back to the concept again of it takes a village, because it is natural for an adolescent to start pushing away from mom and dad. It can be difficult for us to see that, but when there are difficult decisions or when their mood is being affected, it might be finding someone else to connect with. It might be finding there's a special teacher, there's someone who's really connected. It might be a friend who this child has grown up with for their whole lives. It might be someone from the community. Again, it could be church. It could be a neighbor. But this again comes to the link. Find the right path. Everyone has their own path and comfort level. And it may not be mom or dad for that. It may be someone else. So enhancing someone's comfort level to seek that out. So I think connection and finding out who the right person is, or who the right people are, or who the right social group is. Sometimes kids find they haven't been connected, then they get into the musical crowd, or the band, or an athletic sport. But at extracurricular side, find a passion and an outlet and might share with that group. So I think that connection, finding the writer connection.
Anybody else?
I think also get them on someone's radar. If you have a concern and you're not sure, pick up the phone, call a guidance counselor, have them meet with the student, have that guidance counselor talk with a teacher who sees that student on an ongoing basis. Make the connection, get them on the radar.
We talk about kind of scaffolding our kids, and so we know we can't be the only protective factor for them. We need to make sure that we embed, right, and implant additional protective factors, whether that's extended family or neighbors or the faith-based community or the school. And one thing I want to say, because this is a really individualized decision and it can be a challenge, but when we start talking about behavioral health concerns, oftentimes parents and families are hesitant to engage the school. And we respect, of course, that it's a very individualized choice, but I want you to know that the school is a collaborative partner in this process, and they can be a huge asset to helping serve as a gateway to that student, perhaps, to be able to share information on what they might be seeing in the school to help connect to services both within this building and other buildings, as well as the larger community. So it can be a really difficult decision to make, perhaps because of that shame and guilt we may have, which we're working to tear away at. But we have to recognize that the school is here to be a source of support and wants to do so readily and can be a huge asset. So we would encourage you to make the call.
And I think sometimes certain children aren't big talkers, and especially feeling sad, you may not want to talk. But checking in, come up with your own strategy to check in with your child. Sometimes I have folks work on a number scale. Has anyone had like a pain issue that a physician ever asked you, what's your pain on a scale of 1 to 10? Checking in of what's your number to your child. 1 could be sad, down, depressed, 10 is feeling great. Hey, what's your number? Then you don't have to say fine or how do you feel or something that's an intangible. Make it a tangible. It could be with the traffic light, red, yellow, green. It could be a thermometer as an example. But what's your number is a way of checking in to even start that conversation. How you feeling today? What's your number? You can text that. What's your number? And it gets the child or the person to think about, wait a minute, what is my number? How am I feeling today? Wait, my number's a little bit lower this week than it was last week. You get a comparison base. You get a rich field of what's going on, and then you start connecting, why is it lower? Wait a minute, it's finals week. I'm really stressed, or something happened socially. But that's a way, if someone is not a talker of how do you feel, it could be thumbs up or thumbs down. Establishing that can be a private way of checking in without having to make it something where it has to be a big emotional discussion, but it gets it started.
Anybody else? So in talking about the school as a collaborative partner, and Sue, you did reference this really beautifully earlier when I challenged you to talk about kind of school-based services, right? But we did have some questions, and I'm not certain if you'll be able to answer these or not, but can you delineate at all a little bit of the difference between perhaps a school counselor versus a prevention specialist versus a mental health specialist, and what, if any, efficacy or science is behind kind of the success of those different types of services?
Sure. I'll give it my best shot. So again, I think I mentioned that, our school counselors, they're charged with the whole student body and working with them to ensure social emotional learning, as well as all the other wonderful stuff in terms of individual school planning and things that keep kids moving forward, right? Our prevention and intervention specialist, and not every district has that. Downingtown is blessed. They do have that role here, and Sarah is in the front row. And, they're at the front line. They're the ones who are, I don't want to say putting out the fires, but they're the ones who are directly dealing with the students who are at most risk and ensuring that they're getting from point A to point B and the services in between that they need to be safe. At least that's my perception of what they do. And then our mental health therapists tend to be our licensed clinicians who are delivering more of a supportive counseling intervention to provide students who are at a higher risk or with more of a diagnosable mental health condition, supports and strategies for healthier living. Kind of where I'm going?
Absolutely, and certainly some of that is an ever-changing landscape as well, and so I don't know to what degree, if any, when we talk about the implementation of school-based mental health services, has there been a great deal of research done yet regarding its efficacy? Or is that still evolving?
I think it's still evolving. I think it changes all the time. We had the pleasure of meeting with school principals today from across Chester County, and their concern was just, how do we continue to support kids with their mental health needs in school? And we had similar conversation to what we're having tonight, that it is ever changing. And I think schools are doing their best to stay in the running with it and provide kids with what they need.
Thank you. So we are going to conclude with 2 questions because we do have about 15 minutes left before we transition here. So, and we've touched on this, but we had very specific questions as follows, several. So what is the panel's suggestion for how parents should handle communication and discussion of a student's suicide, with the emphasis being a balance of enough information to dispel any rumors and discourage stigma, but at the same time not hoping to glamorize the event and or trigger kids that may already be struggling with mental health issues?
And that's a challenging one. I think it's important to also acknowledge the amount of information that is shared. Sometimes it is, I think Lou spoke about this earlier, it's uncomfortable naturally for us to talk about suicide. It can be a very uncomfortable thing. But talking about suicide does not glamorize and make that occur. There are issues that happen in national spotlight that warrant discussion. If someone like Kate Spade or someone famous suicides, that brings up more conversation. And conversation ongoing back and forth. It can be a very challenging thing, but discussing suicide does not glamorize it. It's, someone must have really been in pain. Let's talk a little bit about this more. I think starting that conversation bi-directionally, the back and forth, and saying, what kinds of questions do you think about when this happens? What comes up when you see this in the news? What comes up when you see this? What happens at school? What do you think about? And eliciting that can be opportunity to have that conversation, but have that conversation, not silence.
Another way to talk is to not necessarily ask them what they think, but what might somebody think? What might other kids be thinking about? When somebody thinks about suicide, what might be going through their minds? What would get them to that place? So that allows them to talk about it in an indirect way, but not necessarily owning it themselves. And the purpose is just to get the conversation going, to start having this conversation with our kids. So whether it's a direct way or an indirect way, the idea is to have a conversation.
I think one of the things that has held us back in this country with respect to mental health is the stigma. And I do think that having open conversations is one way to combat the stigma. I think using the right language is helpful. And there's more information if you go to, for example, the American Federation for Suicide Prevention. There's information about language. But just as one example, committing suicide is a loaded way of talking about that, as opposed to someone died by suicide. And then that's because we have very strongly linked commit, the word, with crime, and commit sins. And so those kinds of things. But I think having the conversation is important. We know that 1/4 of the people in this country have some sort of mental illness. And yet if someone is released from the hospital because they just had a heart attack or they have cancer, no one has any qualms in sort of asking for help or accepting help from a neighbor. But if someone had a hospitalization for a psychiatric illness, they're hesitant to mention that, and that's stigma. And that's something that we can overcome by normalizing this, by making people aware of how many people have this problem. It's not everyone, but it is a common part of our society, and it's something that is we're all better off if people are able to talk about it. Now, that doesn't put the obligation on any one individual who is suffering at that moment that they're obliged to open up to all the rest of us because it's better for society for that to get out there in the open. Of course not. And we recognize that it's a difficult topic, and everybody has sort of a different way of grieving and things like that. But when people have the capability of being open, it really does help culturally. That this isn't something that we should be ashamed of. This isn't something that we should be hiding. It's not something that's going to go away if we don't talk about it.
I would say that, having worked in suicide prevention for about 15 years and knowing so many survivors of loss and hearing some of their stories, when their loved one died, I know that we've come a long way. One of our task force members, one of the co-chairs of the task force, lost a son. It's been more than 25 years ago. And the way things were handled then as compared to now is completely different, night and day. And we really have made great strides, I think, in being able to have those conversations. And it is hard when you're talking about getting the information out to parents. I mean, we're never going to be quicker than social media, right? The information was already out there immediately. So, to be able to follow up with it, to be comfortable, stating that, yes, this is true, it happened, and, now let's discuss it. Let's, be comforting for each other. It is a different kind of grief. It is a grief that is, just filled with unanswered questions and guilt and, just so many added layers when someone dies by suicide. So it's really, really important to start those conversations, as uncomfortable as it may be.
Go ahead.
I just wanted to add, having the opportunity to work with many students during a response within the schools in Chester County, there's an overlying theme that kids want facts. Kids want facts. They want you to listen to what they have to say, and they want you to validate their feelings. And I think if we as educators and as parents and as supports can give them those things, we're a step ahead of everything. They know more than we do all the time. And they want that validation.
So Tracy and Sue just kind of brought us to our concluding question as it relates to survivors of loss, particularly survivors of loss of suicide. And there was a common theme in the questions we had from parents about how to have that conversation. And so I think specifically, are there any recommendations about how parents can talk to their child when they've lost a friend or a peer to suicide?
I think acknowledging that there
Addressing the
is...
issue of guilt in that, please.
Yes, I think that is actually really important to acknowledge that there is guilt, that survivor guilt is very real. It is a normal and expected response. Simply because we've had all these programs talking about what it is that you could do does not mean that we could have or should have done something different. Every case, we don't know all of the whys, and we don't know what might have happened, and you can really make yourself absolutely crazy with the what ifs and the I should have dones. And so acknowledging that those emotions are there, but that they're not to blame, and that they very much deserve to be here and are loved and are supported, because there is the, well, it should have been me phenomenon too that happens as part of survivor guilt. Acknowledging all those emotions and talking about them and being supportive
And we, yes, I agree with all of that. I think it's important to listen to your child, but as much as I believe in suicide prevention, I mean, these programs are invaluable, and I know that they're saving lives. You hear about it all the time, but I also know that not every suicide can be prevented, and you are only responsible for the information you had at the time, and if you didn't know, if you didn't see signs because you didn't know signs, then you can't be expected to have understood what was happening. It's very, very complex. A lot of times we hear one reason why someone took their own life. We hear, well, they were bullied, or there was this, or there was that. And what we know about suicide is it is never one thing. It's always multi-determined. There are always lots of things going on that we may not even know about. So, something that we mentioned earlier, Sue mentioned about talking to people and other people who may help build a safety net for a child. That's really important because sometimes we don't see the warning signs. We're not with someone all the time. So there may be something going on that we're unaware of.
Keep in mind, too, that right now a lot of us are reeling from recent events, and sometimes grief won't happen for many months. Sometimes people aren't ready to talk about anything right now, and it sinks in over time. And out of the blue, 6 months from now, somebody might just break down and start being upset over what may have just happened. And it feels out of the blue, but in some ways it isn't. It just is important to recognize that we all grieve differently, and there's no right or wrong way. And I think it's important that we respect that each of us grieve differently, and however that is, it needs to be validated and respected.
And while talking with your child, how do you help your child cope with the loss of a friend or another student? Validating, everyone feels a little helpless and powerless to it. How did I not see it? What else could I have done? Is there something I missed? We can hit ourselves with those questions, and it's human. Just to acknowledge that's just a reaction, you care. So helping your child to also think about, is there something they'd like to do about this? To grieve in their own way and process what's going on, but maybe do something in remembrance, or something that has heart and meaning, or get together with a team to think about something positive, then they can make a difference. So that out of this, make something, of substance, of something that has heart and has meaning. So that's a potential conversation to have with your child too.
So I want to briefly thank all of you for being here. I want to thank the panel for your expertise, because we all are better because of it. And as in community-based organization, I want to acknowledge and thank the district for being brave enough and responsive enough to open this up and to give us an opportunity to have a crucial, difficult conversation and to be receptive to feedback in that process. It's been a privilege to be able to provide support and work with the school district community, and I want to acknowledge, again, to close for my section, the strength of all of you. Thank you.
Thank you, Jacqueline. So we have collected many of the cards, and unfortunately, again, I do apologize. We won't likely get to all of them. The first several that came in, a couple of themes emerged. So what I'm going to do is I'll ask the final two questions of the panel. I thought it best that I ask, particularly the second one, because there is potentially some input I could provide as a district administrator, and then I'll sort of close us out. So there were two questions really that related to students and maybe some advice that you might have for them. I'll read one of the questions that I think is a good representation of the other. So many of the questions questions tonight have been about what parents can do at home for their children. But for the students and teens in school, what can students themselves do to help establish school as a safe place, especially in times of higher stress or periods of the year? And how can students be better for themselves and for students around them?
That's a great question.
It is a good question. I think students caring for one another, demonstrating that concern, reaching out to one another, saying hello as we talked before, noticing somebody else. If they're in some kind of stressful situation, to just validate what they're going through and talk to them, ask them how they're doing about that. You know, it's that connection, recognizing that they're not alone, that they're being noticed, and that this is okay, that we'll get through this together. Some forms of encouragement, I think, are one of the ways that students can help one another.
I'm sitting here looking at this young lady in the front row with the Edom t-shirt on. And I've said it before, encourage them to connect with a group like that, supporting each other. You're from this school?
Oh, you're STEM.
STEM, okay. But I mean, it's a wonderful group, and you know, that builds the connection too.
Sorry.
That's all right. It's a safe space.
I think it starts with just paying attention to other people. It's very, very easy to get utterly focused on everything that's going on in your life. You're stressed, you've got tests and activities and everything going on. But taking a step back and noticing other people, just looking in the cafeteria, is there a kid who's not sitting with anyone? Is there someone who always used to sit at the same table with all their friends and now they're isolated? Are there people who have their head down in the halls and they're plowing through? Anything like that. Just start noticing. It doesn't take more than a smile or paying attention to someone or reaching out and saying, hey, just wanted to say hello, or sitting with someone or something along those lines. But stepping out of yourself, because I think we're all so incredibly busy that it's easy to just get lost in yourself or, frankly, your phone, staring down, walking through, all that.
So speaking of which, several questions that were written continued along the vein of the use of technology in schools, specifically students having possession of their phone in schools or utilizing technology. And of course, the component that I'll address from an administrative standpoint, one of the questions was, given that there could be a connection between the use of technology and some of the issues we've discussed tonight, why is it that we continue to provide instruction in more technological ways? And so again, I think potentially I can weigh in on that, but speaking to the use of technology in schools and particularly the use of students having phone in schools, do you have any perspective on that? And I know, Sue, you mentioned not all social media being bad, not all technology being bad, but maybe one of you'd like to just extrapolate that on just a little bit.
I probably have way too many strong opinions on social media and access to internet, so bear with me. But when I look at our kids today, they are so smart. They have immediate access to information about everything, where I used to have to go and find a card catalog and look it up and, you know, spend 7 hours trying to figure out an answer. They know the answer like this. So to cut them off of their access and their that's what you have, and you're so much the brighter, but you're also so much more stressed, right? Because you need to know the answer and you have to find the answer, and it's immediate gratification. And how do we manage that? Quite frankly, if kids are able to access media, internet access in this building, you are also very skilled in that, because it's kind of like a black box when you walk in here. So again, I think we have to use it for the good. I think we have to encourage kids to use the internet and use technology for the good.
Sure. And certainly, from an administrative standpoint, I know we have frequent conversations at the administrative level in Downingtown about that balance, understanding that technology is ubiquitous. It's a component of our students' world. And so we really do have to balance preparing them and providing them with the skills that they're going to need, both as high school students and as college students and as adults, with knowing that there might be a better time to use technology and then some other times when, from a social perspective and from a family perspective, that maybe just time to put it aside. So it's a constant conversation that we're having, and certainly that conversation continues. The last two questions that I'll just address directly. The first is, one question here says, when and how will the Safe to Say app be introduced in school? And so I believe it was you, Sue, that mentioned Safe to Say. I'll reference a D-link that was sent home on January 4th. And so the D-link is a communication that's sent from the district to all community members and parents in the district that discussed a little bit of the work we've done to this point. But I would also ask that you look again at the D-link in next Friday, January 25th. There'll be some more information about the dissemination of that information at school. What I can tell you tonight is that we're in the process of planning to train our staff and then our students, and each of those trainings is likely to take place by the end of January. But again, just take a look out for the D-link on January 25th, and there'll be some more information coming about Safe to Say. And finally, one more question. I began the evening by mentioning the outreach that we've received from the community, and one individual in our audience tonight has asked to potentially tell their story or their child's story. And while, unfortunately, again, I don't know that we have time for that tonight, I would just ask if there's anybody out there that has a resource that is interested in they themselves supporting the school district in any way, please just feel free to reach out to us. I potentially failed to introduce myself at the beginning of the evening, so maybe now's the time. My name is Lou Chance. I'm the Director of Pupil Services. So I just asked the individual who submitted this card, please feel free to shoot me an email, and potentially we can have a conversation about an opportunity for you to share your story with whomever it may be. It may be our faculty, it may be our students, but again, I'd encourage anyone else who's interested in supporting to reach out, either to me directly or to anyone they know in their schools. Another reminder, an opportunity to share either your story, your input, your perspective. Tuesday, February 19th. If you're interested in participating in the roundtable, you'll have an opportunity to sign up on our website. That is open now. I believe as of yesterday, we had 74 signees already. So again, you have the opportunity to do that. Tonight, of course, was the first of many steps that we're going to be looking to take to educate parents, to connect with students, to connect with staff. We've also, since last week, added a tab on our website specific to health and safety, where we're providing information about not only things that are occurring within the district, but also in the local community that parents can access, both information and nights like tonight that are occurring across the county. So the last thing I'm going to say, first, I just would like to recognize our panel and Jacqueline Taylor for two things. First, I can say for those of us on this side of the room, particularly the support that you've provided us over the last 2 weeks, I can't say enough. Not only you individually, but the organizations that you represent, the Chester County Suicide Prevention Task Force, the Chester County Intermediate Unit. I'm not sure what we would have done the last 2 weeks without your support. And of course, for being here tonight, sharing your expertise, and just being willing to partner with us as we do this work. So if you wouldn't mind, just stand up, and if you wouldn't all mind giving these folks a round of applause.